All right, guys, here we go. Online learning again. That's probably, I kind of feel like if we stick with full time, the way the numbers are going, we'll probably go, we're in school and then we're online and then we're in school and then we're online. I feel like hybrid is better, in my opinion, because it offers consistency. We're not bouncing between two mediums. It's not ideal, but nothing in coronavirus world is going to be ideal. I feel like this could work if we just stick with something that works. I'm just feeling like if we go to all in person, guess what? We're back to this again. So I think consistency would be nice. That's all I'm saying. That's all I'm saying. It's my opinion. Okay. In class, we skirted with the Matchbox cars, and we went in this order. So we started, if we were coming from above the heart, we started in the superior vena cava. If we came from underneath the heart, we're coming through the inferior vena cava. And then we're like, into the right atrium. Remember, the right atrium just kind of goes bleh, through the tricuspid valve into the right ventricle. The right ventricle, we need a little bit of a contraction behind that. And then we'll go up into the pulmonary semilunar valve, out the pulmonary arteries, into the lungs. The lungs is where we get oxygen, and then we're red on this side. So to see blue was deoxygenated, red equals oxygenated. So we're in the lungs, the heart, or sorry, the blue blood, the blue blood cell. Rip, we're replacing it with the Velcro, with the red one, because now it's oxygenated. We go back into the heart through the pulmonary veins and then into the left atrium. The left atrium goes through the bicuspid or mitral valve. The left ventricle forcefully contracts and sends that blood through the aorta into the body so we can feed little cells in our fingers and our nose and our toes and everywhere else. So that's kind of blood flow through the heart as a refresher. When it leaves the heart, we're going to be going through arteries. So arteries away from the heart and veins go towards the heart. And so we got these large vessels. So it could be the aorta that's like garden hose size, or it could be like the femoral artery that's that's a pretty good beast as well. And the carotid up here in the neck. So those are all arteries. So we have a big artery that we need to get smaller and smaller so we can actually feed the individual cells in our body. So we'll go artery, and then we'll go to a smaller artery called an arteriole. And then we'll hit like a capillary bed where we're going to go ahead and dump off oxygenated cells, pick up carbon dioxide, and then we're headed back. Then we're headed back towards the heart. So we go back through little veins. Little veins are venules. And then we go back through these large veins back to the heart. And you can see that the veins have valves, remember, because we have to have some kind of stopgap measure so we don't get backflow in the vessels. Okay, so this is a lab that I had hoped to do in class. I'm probably not gonna have you do this, but I'm gonna at least show you kind of a test tube, or I'll draw it or something that kind of shows you the percentages of the four components of blood. But you have four components, and there are three that are formed components that are actual cells. And then plasma is going to be kind of the medium, the fluid medium that these cells run in. So every time you see CYTE, that suggests cell. That means cell. In this case, we're going to go the cell that is red. This is a red blood cell. This is the cell that is white. Leuco means white. So those are white blood cells. And these are the cells that are thrombo, which means that they are, they're going to be the ones that clot. They're the clotting cells. And then we have plasma again, that kind of it flows through plasma. So I'll show you a test tube kind of ratio of like what those different ones are. I'll probably have you draw it in the notes. So pay attention when I'm talking to you. Okay, diseases and disorders. On your notes, you will see that there's a little bit of a chart, if my brain serves me correctly. And we have to cover these four diseases and disorders today. So first one is going to be one that affects girls more than boys. And it affects girls more than boys because it a lot of times comes from blood loss. So if a woman is menstruating, then she's going to be losing some blood. And so in those cases, when a female is actively on her her menstrual cycle and her period, then she'll lose blood. And a lot of times you'll see a spike in anemia in that time of the month, which means that we have basically less hemoglobin to carry oxygen to the cells. So to combat that, we'll take iron supplements, or you'll eat things like strawberries or broccoli, that will kind of help and boost with this particular problem. So it has to do with a little bit of faulty erythropoietin production, which is basically a hormone that produces erythrocytes, which are red blood cells. So women who are menstruating or women who are pregnant, so if you kind of think of a woman that's pregnant, is sharing blood supply with baby, and so she can be anemic as well. So every pregnancy, all 3 of my pregnancies, I was anemic for that reason, because that little virus is sucking out all those blood cells. Okay, a myocardial infarction. So if we actually look at this, remember when we're drawing the 60-second heart, MC is one of the 2. So we got like 4, 4, 5, 2. The 2 is going to be muscles, membranes. So myocardial, that's muscle of the heart. And infarction basically means you wrecked it. So in this case, it's kind of showing you a process. So we have some cholesterol buildup, and sometimes the cholesterol builds up all the way and includes the whole artery. But remember in class, we talked about sometimes we just have that cholesterol buildup. A chunk of it starts to break away, and then thrombocytes are there and leukocytes are there to kind of address the inflammation or the infection. And it ends up your own body occludes the whole artery. So in this picture, it's kind of showing you a blue section of heart. So we're saying like maybe there is a compromised vessel here, okay? And that vessel has this happening to it. Well, this section of muscle, it's not getting oxygen and nutrients, so it dies. So a myocardial infarction is basically like the muscle of the heart dying. Okay, so, and it basically is a coronary artery or a branch of the coronary artery. These are coronary arteries. These red ones on the heart is blocked. Causes, I'm gonna update this because Disney Plus is now a thing too. So it could be Netflix and chips, could be Disney Plus donuts. It's you being sedentary and you eating garbage food at the same time. That's gonna cause your heart to have problems eventually. Not when you're a kid, but eventually. Look for that to happen. If we were to count you guys off in class, it would go like this: 1, 2, 3, dead. 1, 2, 3, dead. Because 1 in 4 people in America are dying from heart disease. So this is a good place, a good time in your life to consider, like, what am I eating and how am I exercising? Because it matters. Okay, so a heart attack occurs when blood flow that brings oxygen to the heart muscle is severely reduced or cut off completely. We talked about this, so it's going to be either the plaque completely occluding the artery, or it's going to be the thrombocytes basically helping to block off the vessel. But we have a blocked vessel that's not feeding the muscle tissue of the heart. And then we can't get that monster contraction to push the blood to the body. So here are some signs and symptoms, and I included this graphic because I wanted you to see it's different for boys and girls. So if a man has a myocardial infarction, he'll have some of these kinds of things: discomfort or tingling in arms, in the back, in the neck, in the shoulder, the jaw. They would have chest pain, shortness of breath, versus we have a little bit more with women. And remember, like, this is usually going to affect women a little bit older. They're more likely to have a myocardial infarction after menopause because their estrogen has dropped off. Remember, estrogen protects us a little bit, but this is how women experience it. So there you go. Prevention. Here it is. You guys are going to actually make a heart disease. I'm going to have you basically do a PSA, so a public service announcement that's going to be to this end. Since 1 in 4 of Americans are dying from this, I want you to come up with something that is compelling for Americans to do one or more of these things. Eat healthy, get regular aerobic exercise, manage your stress, track lab values and vitals. Lab values would include things like cholesterol, and vitals would be like blood pressure. So we're tracking like what's happening in your blood, what's happening with all these different foods that you're eating. Get enough sleep, avoid smoking. So these are the things that we can do and the things that I hope that you focus on in the assignment. There is a little video that I will include that just is really short on myocardial infarction. It basically outlines what I've already said. I think it's only a couple minutes long, so take a gander at that. But here essentially is the dying muscle in this picture. Here's where that cholesterol plaque, and included in this one is our own body kind of fighting that in what it views as infection, and it blocks off that artery. So all of this part of the heart, and in this case in the left ventricle, is not going to be able to contract, so we can forcefully send out oxygen and nutrients. So that's a gnarly one. I've seen 2 guys that have come in, they're fatigued, they're like, oh, I just can't make it up the stairs, it's hard. So we put them on the treadmill, and we could see changes in their electrocardiogram, and we basically went, oh, you're going upstairs. You're going to probably need an angiogram and a stent, or an angiogram, and then you're going to need bypass surgery, something, because your heart has been compromised. Okay, treatment, if they actually die from the myocardial infarction, because that can happen, if the vessel blocks off enough of the muscle, it's not going to be able to contract and send those oxygenated cells to the body. So we would have to do cardiopulmonary resuscitation, which is CPR, which is what we practice. That's why I went over it in class, because I kind of thought this was coming. You might have to get a bypass surgery. So we would take a vessel from somewhere else in the body and put it in to sort of bypass the artery that's been compromised. Medications, lots of different medications that could help in that scenario. It might be related to blood pressure. It might be related to cholesterol. So it could be like a statin. It could be a lot of different things. Another disease and disorder that we need to cover is hypertension. So hypertension means that we have high blood pressure. So it means that we're up over, if you look at the normal rates now, 120 over 80 is like high. That's like the threshold. Once you get over 120 or over 80, that's considered like, there's kind of a section. If you go between 120 and 140, it's considered pre-hypertensive, and 80 to 90 is considered pre-hypertensive. But once you're over 140, over 90, that's hypertension. That's a big stress in the body. So they might get mild headaches in this case. If a person is complaining of headaches, a lot of times it could be related to their hydration. They might need to drink more, but if you took their blood pressure and found they were like 150 over 92, you'd be like, okay, that's an abnormal reading. That's high. So let's have you sit here for a couple of minutes and let's check it again when you're totally rested. And if you check it again and we're still at those levels, that's probably when we're looking at things like there's a DASH diet that's specifically for hypertension. Or we're probably going to put them on some kind of a blood pressure medication. So I included this so you could see normal levels. We want to be less than 120 for the systolic pressure and less than 80 for the diastolic. And then you can see this is elevated range, and this is when we start to get into trouble, is down in these kind of the orange and reds. Okay. So treatment, lifestyle changes, it'll be a lot related to diet. Diet's huge. If you can actually get most of your foods from natural plant sources, you're going to be way better off than if you're eating a lot of, we're going to say processed foods. Processed foods, a lot of times your body is like, what are we supposed to do with this like pseudo nutrient? Because there's a lot of just garbage that goes into processed foods. So diet's going to be a big thing. If you look up the DASH diet, that's going to be a hypertensive diet. So if it's something you're concerned about, or maybe someone in your family is experiencing high blood pressure, you can show them that diet if their doctor hasn't already. And in some cases, we're just going to have to put them on some kind of medication. They're probably going to have to lower their salt quite a bit. That can contribute. Okay, atherosclerosis. So remember, athero meant plaque when we were going over that in the beginning. This is when we get that hardening layer of plaque in the vessel. So this is kind of the precursor for the myocardial infarction. I almost think we should have said that first. But basically, we're choking off blood flow to vessels that need blood flow. And the prevention for this is, let's say, Netflix and the elliptical, or Disney Plus and a bike, because you can watch TV and have fun the way you like to have fun, but include things that are healthy as well. Treatment in this case, medicine again, lifestyle changes. A lot of times when the clinic I worked in, we would say like, let's tackle lifestyle changes first, and then we would kind of gauge, is this patient someone that's actually following through, or do they still kind of stick to the habits? Guess what? Adults, probably 90% stick to their old habits, despite having like literally death threats from their own body, basically saying like, you had a myocardial infarction, you need to eat healthy, and they'll start strong, but man, they just get right back into their old habits. It's really disheartening. When you work in the field, you'll see that there are a lot of people that I don't know if they don't believe in it, or if the stimulus, eating those unhealthy foods, is so much better than good health. I don't really get where they're coming from. It's frustrating. So that's something in healthcare. You're going to have to gear yourself up for things like, people are not going to listen. They're just not. So unfortunately, instead of preventing it with things like healthy food choices, we're going to say, all right, since you're in some cases it feels like incapable. They're not, but they somehow are. We'll probably have to put them on medicines, and then we're probably going to have to do something dramatic and really go into the body and fix stuff. I can't stress enough how important it is for you at your age to go, I don't want to go out like this. I don't, there's a thing called quantity. We had a certain number of years. We're averaging out about, I think it's right around 80 for our life expectancy. And I frankly, if I get 80 years, I want all 80 to be quality years. I don't want to be like, okay, 60 we're good, and then the last 20 I'm in a chair like that scary grandma in the corner. I would like to age well. So you age well by doing things like eat healthy, exercise. It's all the things you've been told. There are no secrets about it. You need to just eat healthy, exercise, manage your stress. The things that health teachers have been telling you all along, do them, implement them now, because I can promise you that they're very, very rare that you see someone my age that's like, I'm changing everything, and they actually do. So go into adulthood with the idea that I'm going to live a healthy life, period. That's my vision for you. So in the announcement today, I will go ahead and announce what the assignment is. I'm thinking format for this going forward is I'll throw the PowerPoint out before, or whatever my video is before. So when we come to class, you can ask me questions, and then you can just get started on whatever we're doing that day. So as always, email me with questions. During class, I will be available. So I think what I'll do is just leave Teams on, and then you can just message me. I would say, like, don't freak out if it's been 5 minutes, because maybe I'm taking a lap, because I'm not just going to sit here waiting for it. So, yeah, just get her done today, and then let me know if you have questions or if there's some way that I can improve this. Okay, that's it.